Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're new to my channel, I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories with Asperger's syndrome and the like, and along with tips and advice along the way with your general health versus your mental health, as well as mentoring, advocating and supporting you guys throughout your downtime or whatever it is that you may need at the moment of time. If you're not following me right now, I welcome you newbies, and hopefully that you're enjoying some of these while you've been landing on my page, whatever reason it may be. Feel free to comment below basically if you're new, and let me know what the reason was you came to my channel today, and let's just open that as a full discussion. So if you haven't done so already and you want to join me on the bandwagon, feel free to subscribe, because as I said, I'm hoping to do this as much as I can on the daily, Monday to Friday, or just 3 days a week, Monday, Wednesday, Friday, depending. But if not, just keep an eye out on me, because obviously I'm floating about on Facebook anyway, on some community groups that I'm listed under. So this one's obviously, as I said, is going to be the Autism N series, and at this point of time I thought to bring some more of these because I'm aware that Autism Awareness Month is coming up, so I want to just try and push out as many of the autism related topics that you may hear about or most commonly asked by parents, or commonly questions that may be brought up now and again. So hopefully I can answer these as best as I can. Just a reminder though, these are based on my life experiences versus just what I've learned through my life experiences as well as through school or what have you. I'm no medical doctor, so if you see any warning signs and symptoms in regards to any of these, do seek professional help for yourself or your loved one, or forever don't come down harm. So let's begin this. So this is going to be broken down to maybe 2-3 parts of this next series, as I mentioned in the last piece of that, autism and hygiene. This one's autism and puberty, so hopefully we can get hereabouts to educate you all today with this, and in saying this, that hopefully be a bit of fun in it, or somewhere with me trying to be a bit forgetful of what have you, but that's okay. So as we know, basically, as I said before, that sometimes when we do transition from a young child to teenager and young adult stage, it can be really overwhelming for most of us on the spectrum, and sometimes it brings out a world of pain, sometimes confusion, sometimes a bit of raging hormones and everything else among us, like any normal average teenager as well. In saying this though, it might be for some of us on the spectrum, however, for us child and teenagers, however, we might need a bit longer to understand what's going on with our bodies of the everyday changes, because obviously it's something new while it's changing into puberty, But you as an adult, here to address to you all, if you're an adult, you can help your child to get used to the idea by starting preparations early. Here, say when to start puberty, preparing for this stage for your child obviously will just depend on you. Obviously, if you want to start early, but they reckon the earlier the better, obviously, and bringing up the topics about the changes in our body versus the important stuff, which I'm going to bring in the next series over, which is autism and sexual education. So be on the lookout for that if you're into that, or needing to discuss it with your child or what have you. But bear in mind though, most parents wonder when to start talking about puberty to their children with autism, right? You might be worried that you'll confuse them or with the information that they don't have or need right now. Children with autism spectrum disorder, like any other child, will be curious to know what's going on with their bodies and whatnot, and in saying this, as I said, they may need often time, typically with the developing child, to adjust to and understand these everyday changes, because as I said, sometimes for us autistics, it's hard for us to get used to the everyday changes in our lives, regardless what it may be. If your child isn't prepared for the physical changes, however, that may happen in puberty, she might feel confused or frightened that there's something wrong with her, or even, especially for us females, because of, of all this anxiety levels come up and whatnot. You know your child best, no one else does, and hopefully your child will know themselves best, regardless what it may be, so the best person to decide how much preparation he may need, There might also be other things that influences your decision, regardless of what it may be. If your child has a behaviour or habit, for example, taking their clothes off, that would be best changed before puberty starts. You might start a bit earlier, as I said. They'll need extra help to understand why he can't take his clothes off anymore, Just as a guide though, however, puberty usually occurs or begins around for girls 10 to 11 years and for guys 11 to 13 years, but it's normal for the start of puberty to range between 8 to 13 years in girls and 9 to 14 years in guys. Every child is different, however. But inside this, genetics, nutrition and social factors also play a role in this onset of puberty. There's no way of knowing exactly when your child will start puberty because it's up to the body. Autism spectrum disorder doesn't obviously affect, doesn't affect them when the puberty starts. Many people must think that, since being autism, does it affect them with it or what have you. We'll eventually find out why it's a good idea to talk about puberty early with the child with the autism spectrum disorder, to give them time to adjust to the everyday changes. You'll also hear from parents who share their stories and experiences of supporting children with autism spectrum disorder who are going through puberty. Before you may start to decide to do this, you might like to talk to your child's school about what has already been covered, if they've already talked about puberty, and what will be covered in class. By working with the school as a team network, you'll be able to make sure you're giving the same messages at home and at school so that it doesn't forever confuse them. Child understands certain things, when they don't, but you also need to check about the lessons is right for your child. For example, they don't go too fast or assume the child does understand everything that's going on when they don't. The question you may be asking is what to say about puberty to your child with the autism spectrum disorder. Perhaps your child has noticed how older people are physically different from them. This is a great starting point for discussion. Young children can have a link to having a beard, breasts or underarm hair with having the adult body. For older primary age children, you can use the word puberty. You might say puberty is when a child's body changes into an adult body. Then when your child notices these physical differences in other people, you can talk about them in relation to puberty. This can help your child understand the change from child to adult. Children with autism spectrum disorders, however, might understand what happens to other people but find it hard to apply this understanding for themselves. It can help to make clear statements as you change in children. You may have underarm hair as a classic example. An All About Me book can help your child to see how he or she changes over time. It could include pictures of your child from now and when she was younger, or he was younger. It will also help to explain that boys and girls develop differently. For example, a boy won't forever grow breasts forever. They might grow breasts if they were, developing themselves into muscular boys and whatnot, but not always. Your child might also have the wrong idea about some of the issues, so you need to watch out for things that may need more clearer explanation. For example, extra hair just grows on the underarms and pubic area in women, also in the chest and chin of men, but not all over the body. Language and terminology to be explaining this is for the autism spectrum disorder for your child. You might need to be careful about your use of language, particularly if your child takes things so literally. For example, if you describe your son's voice as breaking, your child might find this really worrying. Instead of you saying something like your voice is changing and your voice will eventually get deeper. You could also explain that men's voices are usually deeper than women's. Your child's father's voice or his older brother's could be good clear examples to explain this. Giving your child both the formal terms and everyday words for body parts might be useful. For example, boobs refers to breasts, breaking when a man may mean a voice getting deeper. The tricky questions about puberty, if your child asks awkward or tricky questions, try to be patient and honest. It's okay to say, I don't really know. Let's work it out or look it up together. If your child asks questions at inappropriate moments, it might help to have a standard response ready that everyone in the family can use. For example, that's a good question, but let's talk about it once we get home. Your child needs to know though, so remember to deal with the question when you get home. You can also help your child to feel good about themselves and develop a positive self-image by reassuring her, especially that physical and sexual changes are a natural part of growing up. Visual supports you can use for your child to understand puberty. You could show your child pictures of yourself at different ages so your child can see that how you look different. This can help your child to understand about puberty, right? You could also use drawings of a body to show how it looks at different ages. Label the body parts and highlight the changes that will eventually happen from getting taller to growing pubic hair, etc. Social stories to help your child to understand puberty. There are some stories that you can create for many topics to do with puberty. If you have a daughter with autism spectrum disorder, social stories might cover the topics of developing breasts, widening hips, starting periods, and so on and so forth. For example, the shape of my body will change. I will start to have periods. If you have a son on the autism spectrum disorder, on the other hand, there'll be stuff like covering penis and testicle growth, erections, wet dreams, and voice changes. My body will look different, my body will do new things, my voice will sound different. Here's an example of a social story on wet dreams. When I was sleeping, I might have a dream. When I wake up, my sheets might be sticky and wet. This is called a wet dream. When I have a wet dream, I should always wash my testicles, balls, and penis when I wake up. Wet dreams happen to lots of boys. Boys can be uncertain when they see semen for the first time, so it's a good idea to explain about erections and wet dreams before they happen. Boys then will need to know it's normal, and it will eventually stop. Relating to wet dreams and erections to other changes he will notice, like growing hair, can develop, help him to understand it's a normal part of growing up. You'll probably need to go over these messages many times over and over again with your child. Try to be patient with your child and also within yourself. You might find it helpful to share your experiences and get support from other parents on the forum that has, children with HD. Puberty in boys. Boys and girls have different needs when it comes down to puberty, and while some of us may feel uncomfortable about talking about these, it's better to get over that quite quick, smart, and be so clear that your son or daughter is well equipped to do with these everyday changes. So with the boys, teach him about wet dreams, as I said. If you don't, there's a chance he'll think he's wet the bed and to be too scared or embarrassed to tell you. 2, let him know it's normal. Associate it with matter-of-fact things like growing body hair, getting better, and teach him what would likely to happen. For instance, changing sheets or underwear, giving his private parts a wash. You may want to use visuals to explain all this while he has no control over whether he has a wet dream or not, so it's best to be as shame-free and calm as possible. Make it clear they are not bad, they are private, and focus on how to handle them appropriately. Number 4, give some tips about how to deal with the unwanted erections. For instance, stay sitting down and wait for it to pass, or cover your crotch with books or a jacket to hide it. You might also look into underpants that fit well, because erections are less obvious with briefs than loose-fitting pants. But let him have some freedom to choose what feels comfortable for him. You may need to make it clear to you that he needs to keep some erections discreet in public to avoid attracting any negative attention around him. Help him to learn to shave. A picture of the face featuring which parts to shave may make this easier for him. Schedule dates on the calendar. Let him watch an older man shave, like a father or uncle or someone, and support him while he practices. If he goes overboard with the shaving creams, travel size packages might be useful here. If he has some sensory issues that might make a razor too unpleasant for him, talk to an occupational therapist. A weighted razor or razor universal cuff might be easier for him to manage. However, puberty in the girls, on the other hand, the big hygiene issue with girls, obviously, as we know, as we get on with it, is the menstrual cycle or our periods. Many girls find this a really anxious area, autism or not, when it comes to discuss this or explain this everyday change. So it's probably a good idea to teach your daughter the basics before the first period hits, so she can be really comfortable. That way she will understand it is very normal and that it's not she's bleeding because she's hurting. A visual monthly calendar could be a good way to let her know how to predict her period, though you should also explain that periods can come irregular when they first start. You could put one up in the house or even have calendars that are downloaded on your tablet or cell phone. So be on the lookout for that. Search for menstruation calendar, but you might also try ovulation calendar, as a lot of them are designed for women planning to get pregnant if they are at a later age that decides to, have kids. When it comes to dealing with the flow, the options of pads and tampons, menstrual cups, etc. basically can be overwhelming. So your daughter might want to make an easier option. But if her flow is particularly heavy or has any other medical conditions around the menstrual cycle at that period of time, talking to a GP is a good idea. Another important issue for girls is starting to wear a bra. The sensation can make them feel so itchy, or even with the girls so sensitive. Another good plan is to get her into the habit of wearing something under her clothes, such as a training bra or a tank top, as a tip here. Before she develops to the point of needing a full-on bra, once you go to buy one, find a shop that does professional fittings if need be. Comfort is key here, so what you're looking for is something that will avoid things that are like itchy lace or some underarm that fits and something that fits well. Bras can get sweaty, so you might want to have a visual schedule to run behind her. Also, to change your bra and put the dirty one in the wash every few days. So this quickly ends a bit about autism and puberty, getting ready for the changes. Smash the like button, comment below. Feel free to follow me on my social medias listed below. Feel free to actually give out any information if you've have a child with autism, how you go about explaining all those changes of the body and whatnot, and what do you do to be prepared for your son or daughter. Feel free to also, if you haven't done so, as I said, subscribe to my channel if you want to join me on the bandwagon. Feel free to also, you know, subscribe so that you can keep up to date. Well, not for the guys, thanks for support, thanks for watching, do what you love what you do. Until next time, Aspie signing out, and I'll see you again soon. Ciao for now.